Hey everybody. Can you guys, anyone that's watching on a computer right now on YouTube, if you could jump into the chat box and let me know if you can hear me. I just want to make sure that our audio is doing well. And once I know that you guys can hear me, we will get started. It shows that you can hear me on my end, but I just want to make sure. We've got a few people waiting in the wings here anyway, from Ohio, from the UK. Welcome. So you guys can hear me. I've been told that you guys can hear me. So as we're going through this today, anything that you may want to talk about, if I don't address it, you're welcome to throw it into the chat box. So for most people that are on YouTube watching this, you are going to be able to see along the right-hand side of your screen, you're going to be able to see a scrolling chat. And at the very bottom, it will give you a place that you can enter to say something. I've got a lot of emails, especially in the last few hours, about topics to cover. But I will, if we get through those emails, then I'm going to jump into the comments just to make sure that I can try to address everyone's concerns. So, thank you, Delane from Portland. See you throwing it on there that you can hear me. Perfect. So for any of you guys that don't know me, I am Dr. Ben. So I've been a chiropractor for about 10 years, and I was a personal trainer for, I guess, about 10 years before that as well. Most of that in Canada. I went to school all over the world in the east coast of Canada, and then in England as well, in Chichester on the south coast of England. And then I went to school in California. Then I moved to Calgary in Canada, and now I live in British Columbia. So here I am right now. So my role at Better 5 is not just to be a pretty face, it's to actually make these courses for you as well. So it's actually really important to me that I can show up and talk to you guys, specifically to know what it is that you're struggling with, because Better 5 has been an amazing company to work for and work with, and it allows me to deliver a lot of the knowledge that I have. They don't give me the topics, they give me guidelines, and then I actually have to make all of it up myself. So a lot of it is, most of it is coming directly from me and from my brain and from my training. So this is a really good opportunity for me to learn from you guys and exactly what it is that you want out of Better 5, and answer hopefully a few questions. So I've got a lot of emails that I'm going to get started with, and let me see if there's anything else. Nope, that's about it. So we're going to start in on some emails here, and I'm not going to say the full names of people who have written these emails, but I'll at least try to take a jab at first names just so you know if it's your email specifically. So Joyce is asking if I have recommendations for helping to eliminate severe arthritis pain in the feet. So arthritis, for anyone that's listening, by definition, it's just the word itself means pain in a joint or inflammation in a joint. So arthritis, there's a lot of different kinds of arthritis, but usually we start to get more of it later in life, and we start to associate it with being a little bit later in life, purely because our joints start to get a little bit more worn. Arthritis does not have to hurt. But in a lot of people, it does. And a lot of that's actually associated with inflammation. So specifically in the feet, one of the easiest things that you can do is actually constantly be working on them. So I'm not sure if it's published yet, but I've made a course on feet specifically. And a lot of it is around self-massage and mobilizing the feet. So the foot is a lot like the hand in that it actually has a lot of small joints in it, even the ones that you can't see. So most of us, we can see our toe knuckles and out, and that's all we see. And the rest of our foot looks like it acts like one, but there's a ton of joints and a ton of bones in our foot. So getting them all moving past each other with something like a golf ball or a lacrosse ball, or even using hands, should actually help quite a bit. That's the thing that I would do. I've actually broken something like 9 bones across both of my feet, one of them twice, so I guess 8 bones. So I started getting, and that was when I was a teen, and so I started getting arthritis in my feet pretty early. And it's one of the things that I do regularly is I roll the bottom of my feet and I mobilize my feet. So that's one thing I'd probably recommend, is starting to actually physically work on your feet with some kind of input. So next, this is for Marcia or Marcia. Are there any particular exercises that relieve fibromyalgia or pain without a known cause? For example, are strengthening exercises more effective than aerobic? So generally speaking, fibromyalgia is not extremely well understood, and it's usually associated with pain that's broad, meaning it's all over the body in a lot of different places without a known cause. depending on your history, you might have pain all over your body, but each one of them has a specific reason. I've broken more than 24 bones in my life. I've played pretty hard for a lot of my life. And so I've got a lot of different pains in a lot of different places that I've had to figure out how to deal with, but it's not fibromyalgia. So fibromyalgia would be if you've never had an injury in an area and yet the area constantly hurts or it comes and goes. So with fibromyalgia, for the vast majority of people, it's focusing on a lot of the big lifestyle things will actually tend to help significantly more than any one intervention, meaning focusing on sleep hygiene. So we have a sleep course, for instance, focusing on exercise, and specifically, Marcia asks, strengthening versus aerobic. Strength training for the vast majority of people is going to be significantly more effective than aerobic exercise when it comes to pain relief. And when you do strength training, you actually get gains in your aerobic capacity. But when you do aerobic training, you do not get gains in your strength capacity. So for the vast majority of people, strength training is actually, when we say strength training, we mean resistance training, is significantly more effective as kind of a broad spectrum approach to exercise than is any form of aerobic exercise, purely because you actually are kind of hitting two birds with one stone. So for fibromyalgia, I don't have anyone in my personal life that's got it, but I have had a lot of patients with it, and usually exercise is a big part, but then things like sleep hygiene and meditation really help as well, because fibromyalgia is systemic. It can be top to bottom. Are there any, so this is for Wendy, are there any exercises that can be done to improve severe or painful arthritis in the hands and fingers? So this is going to be very similar to the answer about the feet, in that arthritis it's a non-specific term. Some arthritis is due to damage. So I've got arthritis in a couple of the joints in my feet, as you could probably imagine based on what I just told you about my injury history. But that's specific to damage. But if arthritis is broad, meaning it's in all your knuckles, it's in all your fingers, a big thing that can help for a lot of people is going to be strengthening. Your body actually responds really well to strengthening. So grip strengthening and forearm strengthening and wrist strengthening will help. It's going to be uncomfortable to do if you have severe arthritis, but it does actually usually help in the long run. And then another thing that most people find as well, just when it comes to taking care of the symptoms themselves, is going to be heat. So one of the things I recommend for some of the people I work with is if they're severe and they really don't react well to the cold, I'll actually get them to physically heat themselves up in a sauna, or put their hands in some warm water and get them nice and loose and mobilized before they exercise. And then as they exercise, that'll maintain their core temperature and actually help things to feel a little bit better. And then another thing that you can do as well is it's simply mobilizing. So even though joints have arthritis and that can come with a little bit of damage, it doesn't always have to. For a lot of people, actually mobilizing the joints, meaning moving them around through their full range of motion, will help to get a little more fluid inside the joints that will lubricate and can help quite a bit. But for most people, some form of strength is usually the easiest thing to go after. So this is for Inga, who says, I have a lot of trouble shutting down my mind when I'm trying to go to sleep. Do you have a strategy that works to solve this problem? I've tried everything I can think of. P.S. Took your sleep program and found it enormously helpful in a lot of ways, but still have problems as described above. So shutting down your mind before going to sleep is probably the curse of the 21st century for a lot of people. So one of the main things that you can do, so most people, I started meditating years ago for very similar reasons. I wanted to be able to essentially control where my mind was going, and rather than it taking me on a ride a lot of the time. And so training in meditation, and the reason I say training in meditation is because it's a skill that you don't just have automatically built in, but training in meditation is probably one of the things that you can do to help learn how to turn off your mind. But most people, while they're going through the process of training their mind, not to think of nothing, but to at least be able to tell it what to think about, is to replace the thoughts with something specific. So a lot of people, when they're trying to fall asleep, they want to think of nothing. They want to empty their brain, and that's for the most part impossible. One of the easiest things that you can do is to actually choose a topic. And for a lot of people, the easiest way to do that is through journaling. And so going through and doing a big journal mind dump of a lot of the stuff you don't want to think about, just getting on paper, it'll remind you to think of it in the morning if you have to, and then choosing a topic and writing about it or thinking about it and doing it in a systematic way, a lot of the time will actually help people to kind of get that mind dump, and it'll calm them down, because there's really no such thing as turning your brain off, but helping it to concentrate on something that's a little less stressful or a little easier to think about or joyful is a really good way to do it. So for example, for me, I did it with snowboarding for the vast majority of my life. And I actually had to choose that. I would go to bed, I'd read before bed, I'd do all the things in our sleep course, a lot with my environment and a lot of the other things to prepare my body to get ready for bed. But then I would literally, as soon as the lights went out, I would intentionally start thinking about snowboarding, because that's been a hobby of mine and my wife's for over 20 years. And that's one of the things that we do together. It's one of the biggest joys in my life, is going into the mountains. And so I would go to bed dreaming of snowboarding every single night. And that helped quite a bit. So this is for Sarah, who says, how much calcium should a 78-year-old woman be taking each day, and how much vitamin D is needed for maximum absorption? I do have osteopenia. So Sarah, unfortunately, that's a question that I can't answer in this context. And the primary reason being that when it comes to absorption of nutrients and when it comes to the things that are going to help with osteopenia, it's going to be very specific. What I would recommend is finding a functional medicine doctor or finding a naturopathic doctor. Depending on where you live, they may be regulated or not. But I would just figure out if you're in a state or somewhere in the world that naturopaths are regulated. And if they are, I highly recommend you go see one. They're going to be the ones that'll probably help you the most with this. It is really important that you get calcium into your system, but a big misconception about osteopenia and osteoporosis is that it's just about calcium, when it's actually about a balance of a whole lot of different minerals that allow calcium and other minerals to stay in your bone. So it's not quite simple enough that I can just answer it unabashedly for anyone. It's really got to be specific to you. So I'm sure that applies to a lot of people here. But if that does apply to you, I'd encourage you to find some help for one-on-one on that. So this is for Pam, and she asks, if there's one exercise you could choose to be the best one for arthritic ladies, which would it be? So that's not an easy question, because arthritis is going to be different depending on the type. So rheumatoid arthritis, for instance, primarily affects the fingers and hands. Certain kinds of arthritis affect knees, hips, shoulders a little bit more. But when it comes to a single exercise, I can't really say a single exercise because that's going to depend, but I could say a single type of exercise, and that would be strength exercise. One of the things that tends to happen as we age is the more things hurt, the more we avoid them. And there's a difference between discomfort and hurt, injury. And so what I want most people to do as they age is I want them to consistently pick up heavy things. And heavy is going to be a relative term. So at my age, picking up something 300 pounds is entirely within the realm of normal. But if you're 70, picking up something that's 85 pounds, 95 pounds is something I like people to be able to train to do. And one of the reasons is that it benefits you broadly. And most of the ways that you will actually train to be able to pick up a heavy weight are not going to be really demanding on most of the joints that people have issues with. So if I had to pick one exercise, I would say it's a deadlift. Which would be done with a kettlebell or a barbell or a sandbag. Can be done with a lot of different implements, but a deadlift is probably the number one because it doesn't take a lot of range of motion out of your wrists, out of your knees, or out of your hips, which are the big areas that people have issues with arthritis. And strength training in general is going to have a huge carryover to your aerobic capacity and longevity. And it's really going to help with a lot of things in life as well. So categorically, strength training. If I had to pick an exercise, I would say the deadlift. And I realized, so earlier in the email, Pam said she's 73. My grandmother's 83, and I have told her the same thing. And she has pins in her hands and her feet from severe rheumatoid arthritis, and I would tell her the same thing, unabashedly. So this one is from Donna, who says, I have a right shoulder tendinitis/tendinosis. It's interesting that you differentiate those, by the way. Most people don't. And also arthritis in both shoulders and neck. Can I do physical therapy exercises at home daily and go to a chiropractor about every 4 weeks? Things are stable, but not improving much. The tendinitis/tendinosis was diagnosed on MRI. Should I get a new MRI? So the interesting thing about a tendinitis and tendinosis, for anyone here that's had them, they're very similar across the entire body, whether it's a golfer's elbow or a rotator cuff tendon, or in your low back even. They're very similar in that the primary thing that actually changes a tendinitis is how you load it and your inflammation control. So your inflammation control for most people is going to have to do with their stress levels and their nutrition. And it's amazing to me how so many people, if they start sleeping more, tendinitis starts getting better because it actually changes your inflammation and your stress. But then the main thing that tendonitis responds to is how you load it, meaning if you do too much, it hurts really bad. But if you do absolutely nothing, it won't get better. So finding either a physical therapist or a strength and conditioning specialist or a chiropractor or kinesiologist, someone who is going to encourage you to exercise progressively and give you a really strong framework is where I would start. Because what you've laid out here, essentially, can I do exercises at home and go to a chiropractor? That's a great combination. It's more a matter of whether or not you are doing the right amount and when. It's just like food. Exercise is like that when it comes to rehab, in that if you eat way too much of it, it's not going to go well. If you don't eat any of it, it's not going to go well. There's kind of a Goldilocks thing going on in between. So when it comes to exercise for tendonitis, it's really about the appropriate amount and having someone give you the right exercises in the right amount, and then auditing as you go forward and slowly progressing. So for a lot of people, tendonitis is a big issue, and the shoulder is notorious for being very difficult to get rid of. But it's mostly about load and secondarily about inflammation. I've got another screen over here in case you're wondering. I'm checking all these emails. So this is from Maham, who says, I'm a stroke survivor with limited mobility on the left side of my body. It's been 3 years. I do daily physical therapy and see slow progress. My question is about pain. Very recently, I've noticed my left foot has started to hurt when I walk. I hadn't experienced this before. Could you help me understand how to deal with it? So I will say this. Thank you for that question. Neurological rehab is a whole other world. And by neurological rehab, I mean when you've had a stroke or you've had any kind of brain injury or an aneurysm or anything of that sort. It's an entirely different world. So I'm going to have to withhold a full answer on that one because it's all extremely specific person to person, just like some of these emails are going to be. They're going to have to be extremely specific. What most people should be doing, I see you in the comments here, at 35, honestly, it's unfortunate that you had a stroke, but you should be able to make progress. You should be able to make a lot of progress. It's going to be very slow. I've unfortunately, and every single nervous tissue, meaning your spinal cord, your brain, or a nerve somewhere in your arm even, they take slower to heal than almost any other part of your body. So unfortunately, for a lot of people, it takes years. I don't talk about this very often in Better 5. I had meningitis. So I got it about 10 years ago, which is, for anyone listening, it's an infection of the lining of your brain. It can mess you up pretty bad, and it did. It messed me up quite badly. And I lost the ability for cursive writing. I developed a speech impediment. I lost a lot of my fine motor skills. Had a lot of issues from it. And it probably took about 5 to 7 years before it was a notable difference. It's unfortunate, but, you know, it happens. And so I'd really encourage you to find a physical therapist specifically that specializes in neurological rehab. Not just any physical therapist, but one that does neurological rehab. That's where you're going to find the best luck with all this. Because pain is a nervous system and neurological thing. It might not be something wrong with your foot, but there's no way for me to know that. All right, this is from Wendy, who says, I love your videos and I'm doing your new hip chair video now. Awesome, Wendy. I would love it if you address problems with the TFL resulting in IT band pain, what I thought were tight hip flexors, and even outside knee pain. I've also been doing your chair and knee video. How would you recommend relieving TFL issues? So for anyone watching, the TFL is actually a muscle that's on the front outside of your hip. So essentially where the entrance to a pocket is. That entrance to a pocket right around there, there's a chunk of muscle on the outside, not straight on the front, but on a 45 degrees. It's called your TFL, which is short for a long Latin name. But the Latin name, oddly enough, means that it is the thing that controls the tension of your IT band. And your IT band is the thing that goes straight down the outside of your upper thigh and attaches to the outside of your knee. So if you have IT band problems, a lot of the time it'll actually give you what's called an IT band syndrome, which is pain on the outside of the knee, usually going down a hill, getting up and down out of a chair, or anything you do that really engages the front of your thighs. So for most people, a foam roll on the floor is not the easiest. It's the way you're going to get the most pressure into the TFL. It's how I've worked on mine. But if you have a difficult time getting on and off of the floor, then getting into a TFL in a standing position using a rolling pin is the way I'd recommend for a lot of people, because then you can get 2-arm pressure and you can really push straight down on the outside. So I've used a rolling pin myself. It's in one of our courses that we work on the front of the hip, and we specifically work on the TFL. But I would recommend the vast majority of people use a rolling pin and do it standing up, because once you bend your hip, so your knee comes up towards the front of you, it's actually very difficult to dig into it because it kind of disappears under some layers. So I do it standing, and I would do it with a rolling pin. Are there any exercises that help de Quervain syndrome? This is from Yvonne. I've tried all sorts, and it just seems to be getting worse. I've had it for over a year now. So de Quervain syndrome is difficult. For anyone that's watching, de Quervain syndrome, it's named after a Dr. de Quervain, it's the named version of stenosing tendinosis, which is a big fancy name, but it's an infection, or sorry, not an infection, an inflammation of part of your thumb tendon. So there's a thumb tendon that comes down here and goes down your upper arm. And there's usually in most people a little bump in through here when they have de Quervain syndrome. And so for most people, I've had people who have had it and have gotten rid of it. For most people, it's really important not to irritate it, but it responds typically quite well to using something called voodoo floss. I know it sounds magical. It's not. It's just a compression band. You can use something called voodoo floss, and you can do something called IASTM or Graston. IASTM stands for Instrument Assisted Soft Tissue Mobilization. A good physical therapist or a sports chiropractor, especially one that does active release technique, they'd be able to help you out with it. I've had plenty of people who have had it over the years. It's not usually that hard to get rid of if a therapist knows what they're doing with it. It's just you're going to have to find someone that's really confident with it. But de Quervain's really uncomfortable. One thing I'll say, if you're listening in here, Yvonne, is do not get a cortisone injection into it. That's been the standard of practice for a long time, is to get a cortisone injection. And if you do a cortisone injection around a tendon, you can accidentally rupture the tendon. And I have had, unfortunately, one patient that's happened, where she woke up in the morning and couldn't lift her thumb anymore, and they had to do surgery to transpose a tendon off of her first finger, because cortisone can actually deteriorate really quickly. It can start to eat away at a tendon, especially in that area. So don't get the cortisone shot, whatever you do. Okay, we've got a lot of chat, so let's jump into the chat. So I'm not going to be able to give you first names on this one as much, but one of the questions here from the Sands117 is anything special for low back lumbar issues? So statistically speaking, the number one thing that you can do for low back issues is exercise. And it's, for the most part, doesn't have to be that specific to it, but it's got to be strength-based. So walking in a treadmill won't do it. Doing yoga might help, but the things that have been shown to help the most are actually, oddly enough, Pilates and strength training when it comes to a broad, non-specific low back issue. If you have pain in the low back, I'd encourage you to get it looked at, because there's a chance that it's something that is going to need to be addressed medically. Not likely though, and most of the time it's exercise. So that is, statistically speaking, across all the research in the last 50 years, the number one thing you can do for low back pain is strength training. And Pilates, oddly enough, is at the top of the list for things that you can do. So this is from Marcia. Hi, Ben, you changed and fixed my life. Awesome. Thanks to Better 5 for that. They gave me the opportunity to show up here and do this with you. I'm very agile, but broke my hip riding the grandkid's scooter. Grandkid problems. Broke my hip. 24 physical therapies later, still limping. Your hip restoration got me walking again. Thanks. Apparently, I was just tooting my own horn there. I thought this was a question, but apparently not. Well, you're welcome. I've had a lot of hip issues as well. I'm actually currently on the wait list for a hip surgery. I was an ice hockey goalie for 20 years, which is what happens when you grow up in Eastern Canada. You either play hockey or you play a different kind of hockey. That's it. So anyway, I understand. I've had hip issues for a very long time, and sometimes it doesn't go very well. From Andrea Thomas. I wonder if your hip strengthening classes are suitable for people with an anterior hip replacement. Yes, very much. So hip replacement, one of the things that happens a lot of the time is we lose a lot of the strength around our hip. Not necessarily. Some people I know haven't. I have a good family friend that actually had a hip replacement probably about 18 months ago, and the nagging thing was a lack of strength. It hurt a little bit, but most people that have got a hip replacement will tell you it feels way better afterwards. But it was a lack of mobility in certain directions and a lack of strength. So yes, the hip strengthening course is definitely great for people with an anterior hip replacement, because we don't go into any extreme ranges of motion that might threaten the integrity integrity of that hip replacement. So it's a great course for that sort of thing. Deb Baker asks, what are the best core exercises for seniors? So that's going to be actually quite different person to person. When it comes to core exercises, I would look up, there's a set of exercises that are designed to be usable by almost anyone, designed by a researcher out of the University of Waterloo, and his name was Stuart McGill. And they are called the McGill Big Three. And they are extremely well known across most therapy clinics, a lot of strength and conditioning. They're going to know the McGill Big Three. And essentially, it's just meant to address how your core functions in a 360-degree fashion, a front to back, a side to side, and a twisting motion. And so it's 3 exercises that all progress naturally. So you can find guided versions of the McGill Big Three on YouTube. And then we've got some low back and core exercises as well in some of our courses. And I have those movements integrated into our courses. But if you're going to go look on your own, I'd encourage you to find the McGill Big Three. Karen says she has a sudden onset of left groin pain and giving when walking. Can't recall injuring it and using a cane now. 65-year-old and history of arthritis. So if you have a sudden onset of groin pain, I would go get that looked at. Sudden onset is usually one of those flags. So if you've taken a few of my courses, you've probably heard me talk about sudden onset of pain with no known injury. And the reason I put that in the medical disclaimer is because it could be one of these injuries that doesn't result from trauma, such as a hernia. So the vast majority of people have this misnomer that a hernia comes from straining too hard, but the vast majority of inguinal or groin hernias, they actually come seemingly out of nowhere. And there's no way to know which age you're going to get them and what the activity is that's going to cause it. One of my best friends, one of my training partners, he actually lifts weights with me. He was 28. And one day started feeling groin pain, didn't know what it was from, and went to get checked out. Come to find out it was a quickly progressing hernia. Ended up getting surgery on it. He's fine now. So I would get that one checked out. Sudden onset, and if you didn't injure it, make sure you get someone to take a look at it. So Shannon Miller says, I haven't had full range of motion in my knee for over 2 years. I can't fully straighten it or bend it. Can a chiropractor help with that kind of injury? I will say this, it depends on the chiropractor. I would go and look for one that claims to work with athletes primarily. And I know that if you're later on in your years, which I have no idea if you are, Shannon, if you're later on in your years, a lot of people avoid the term athlete and they avoid things like strength and conditioning. But the reality is that's when it is most beneficial for you. You can get away with a lot of crap when you're a teenager and you're still going to be fine. Later in life is actually when you should start treating your body like an athlete. And I would actually go and find a sports chiropractor specifically, depending on what part of the world that you're in. They're the kind of person that would be able to do really well by that. If it's something that won't fully bend or fully extend, it probably has nothing to do with your spine. It might, but it likely has nothing to do with your spine. And so you're going to need just a really good assessment on that. And I would find a sports chiropractor for that one. Do you have any suggestions for a 46-year-old who has CP in lower extremities and needs to keep range of motion and mobility? Yeah. I mean, when it comes to the specifics, it's going to be different for every single person. The reason I say that is it's going to depend on their arrangement. So a lot of people, depending on the level of function that you're in, that you have, you can do a lot of your mobility yourself. What I would do is I would, rather than invest a lot of time and energy into trying to find the exact right exercises, I would invest in a setup. So one of the things I've got is essentially like just a little torture chamber at home where I have yoga mats. I have like 5 different kinds of foam rolls, a bunch of yoga blocks, stretching straps, rolling pins, lacrosse balls, trigger point balls, yoga tune-up balls. And I've basically got this kit that will fit into a duffel bag that allows me to passively and easily get my body into almost any range of motion that I want. Once you've got that, it's really easy for you to start to learn how to take care of yourself. So for most people, you can accumulate all this stuff for $100 or $150 total, and you never need to replace it. It's just something you're going to have forever, and you can use that as kind of your toolkit. You know, so everyone, whether it's big or small, whether you live alone, no matter if you're male or female, everyone's got usually a couple of tools in a toolkit around their house just to take care of some basic stuff. You know, they've got a hammer, they've got a measuring tape, they've got a couple of wrenches. I'd encourage you to get that when it comes to your body. Just get that set up, and then you can start testing things that work for you. And if you're functional enough to start doing it all on yourself, I'd encourage you to do it all on yourself. But it might depend on just how functional you are and whether or not you have other people in your life that are willing to help out. But I'd encourage you to really get the tools that you need. Once you have the tools that you need, you can just start experimenting. And there's really no risk to just getting a lacrosse ball and starting to jam it into certain places and getting a stretching strap. And as long as you go gentle, start using it. So this is from Inga, who asks, what causes ankle and foot cramps in my feet after I have gotten in bed? So that is the most common cramp in the entire body, is either calf cramps or foot cramps after you get into bed. There's a big misconception about cramps that they are usually something to do with hydration and that they're usually something to do with minerals. So people will jump on eating a banana, for instance. But the reality is you are no more or less hydrated the second you lay down in bed. You are no more or less have mineral issues the second you lay down in bed. The vast majority of what causes cramps is actually a lack of control of those muscles. So I could, on almost any human being, I could make them cramp just by getting them into a specific position and asking them to do a specific exercise. Because cramping usually has to do with whether or not our body has the ability to control a specific movement. So our feet spend most of our day, our ankles spend most of our day at 90 degrees. You know, they're straight up and down like this. And then as soon as we lay down, our foot relaxes and it kind of does this and it curls. So all the muscles that are on the bottom of our feet, they go from being stretched out and active all day to all of a sudden when you lay down, they go to relaxed and shortened. And that's usually when things start to cramp up. So one of the things you can do if it's temporary and you've never had it before is you can get what's called a Strasbourg sock. Strassburg, maybe. You can find them at running stores usually. And what they essentially do is it's a sock that holds your foot up at 90 degrees while you sleep. So it keeps your toes up, it keeps your foot at 90 degrees, and it prevents you from getting into that position. They're not the most comfortable thing in the world, but a Strasbourg sock has actually solved that problem for a lot of people. Another thing that you can try is, it's not the most comfortable thing, but you can start rolling the bottom of your foot before you go to bed every night. And then another thing that you can do is actually start exercising the bottom of your foot. Most people, once they get strong enough feet, strong enough calves, and it's mobile enough, those cramps will go away on their own. But if you want a quick solution, that's not going to take you training to do it, I would go and find what's called a Strasbourg sock. That will really help you out. And I have people who are 80 wearing it. I have professional athletes that wear them. They are useful across the board. So Connie says, my neck seizes up a lot lately, and there's any exercises I can do to let it relax. So when things seize up, that description is different person to person. If it's that it gets really tight, then a lot of the time self-massage is really going to help. We've got some self-massage courses coming that I've designed as well. If it's that it feels like there's kind of a kink in it or it's stuck in some way, a lot of the time getting to see a chiropractor a few times will help, but also mobilizing with a strap. So actually having something that you use that pulls on the back of your neck and ends up acting as a fulcrum around which you can move will usually help to kind of unlock it a little bit. But that's going to be very person specific and issue specific. Connie, if you're still listening here and you want to jump into the comments and kind of explain it a little better towards the bottom, then I'll get to it in a bit. So Palmas said, I was wondering if there's one better way to sit to lessen hip aches when I get up, better for knees wide apart or narrow, or knees higher or lower than hips. So for the vast majority of people, they're going to feel a little bit worse if their knees are higher than their hips, meaning if you're sitting kind of at a 90-degree angle where your femurs are straight out, anything above that, usually your hips are going to feel a little bit worse the longer you've been sitting, and anything below that is going to feel slightly better. That's for most people. So the other thing too is that's assuming your back is neutral. So oddly enough, if you sit really up and forward with a really upright posture and your knees are up above 90 degrees, it exaggerates everything and usually makes it worse. So knees slightly below, so your femurs, your upper thigh should be slightly below, parallel to the ground. And then I shouldn't say should be, but it's something you can do to help relieve the hip issues if you've been sitting for a while. And the other thing you can do is bring your feet closer together, let your knees fall apart a little bit. This is going to be specific person to person. If you've got arthritis in your hips, it's going to be very different person to person, depending on what part of their hip has that arthritis. But for most people, it's going to be the best if they can have their knees just below the height of their hips or their pelvis, have their feet basically touching each other and let their knees fall out. And that's how I sit, because I've got all sorts of hip issues from decades of playing ice hockey. And so I actually, instead of having my feet flat on the ground when I sit, a lot of the time I actually have oddly enough, the bottoms of my feet facing each other so that my knees can be aiming outwards, because that's the most comfortable position for my hip, as long as it's not falling all the way out. There's usually somewhere in the middle that feels really good. And it's going to be kind of different person to person. So I would play around with it. Most people actually are going to find sitting towards the front of their chair and letting their knees and all of their legs be below their hips and pelvis is usually going to help their hips after they've been sitting for a while. And she also asks, since sitting seems to cause the hip pain, can you tell me which muscles I need to concentrate on, stretching or strengthening, to help alleviate it? It's probably glutes more than anything else. It's those butt cheeks. So the butt cheeks are the main movers of the hip. But interestingly, some research has actually come out just this year, essentially showing that you can train the hamstrings, you can train the butt cheeks, or you could train the groin. All of them will actually help. And I'd encourage you to train all of them a little bit. But strengthening is probably the main thing that you can do to make it feel a little bit better. So we are going to jump back into email questions because we've got a few more. All right. This is from Francis or France. I've followed the exercises for knee and hip restoration, but each time I've had a lot of pain. I have arthritis in both knees and right hip. Can I split the exercises, or, for example, do half in the morning, then half in the afternoon, and will doing the exercises help ease the pain and stiffness I get? Yes, across the board. You can split it up as much as you need. One of the things that I actually love about the way that Better 5 operates is you can hit pause. If you have to go to the bathroom, hit pause. If something comes up, you can hit pause and you can come back later. And one of the things that we don't talk about a lot, but it's how Better 5 is built. You can take the course and you can go through it, and then you can just start all over again. It's still there. It doesn't expire as soon as you're done. You can go through and you can just skip exercises just to see how it feels the first time through, and you can come back. So that's something I actually started encouraging most people to do if they can at all, is to go through the course, skip what they don't like, come back and try it again later. And I encourage you, if you need to do a little bit in the morning, a little bit in the afternoon, or probably more commonly, people are going to do, if it's a 5-day course, they'll do Monday, Wednesday, Friday, take the weekend off, and the next week do Tuesday and Thursday, and then see how they feel, and then maybe start the whole thing over again. So that's pretty common that people split up the exercises. This is your shoulder course really helped me, and now I've started your hip renewal course, which is already helping. Thank you. I have 2 questions on hip pain. I think I just read your comments in here, didn't I, Palma? Yeah, I did. All right. I think you're still watching here, Palma. So I will come back to this one if we have time. So this says, please ask Dr. Ben about help for chronic trochanteric bursitis. I've been told there is no good solution. Will you provide a recorded version? I'm at work, I may not be able to watch it. All right, well, hopefully later you'll be able to watch this, Barbara. So I'm getting the thumbs up from across the room. Apparently we are recording this. Perfect. So trochanteric bursitis is pain on the bone on the outside of your hip. For anyone that's not familiar with the term, it's really common that people get that when they lay directly on their hip or go for things like a long walk. So the only thing that's very likely to help with this is going to be a topical anti-inflammatory. And I don't mean a topical rub. Like it's not going to be menthol or capsaicin or something that heats it up or cools it down. It's actually got to be a medicated topical anti-inflammatory, and it's got to be mega dosed. And by that, I mean, we have something in Canada called Voltaren, and it's a topical diclofenac, which is, it's like a Tylenol that's meant to absorb through the skin. So it's a chronic bursitis is an inflammatory problem. Itis means inflammatory in the medical world. An inflammatory bursitis, it needs some kind of big anti-inflammatory kick. So you can help with your diet, but something you need to do is just be mega dosing for about 5 to 10 days on a topical anti-inflammatory. So something that you can rub on top of it that's actually medicated, and it can be over the counter. So here in Canada, people get Voltaren. It's just got to be a topical anti-inflammatory. And when I say mega dose it, I mean you're putting it on 5 to 10 times a day for 5 to 10 days. That's the only thing that's usually going to kick these sorts of things. And even then, it might not get rid of it, but it should make it feel significantly better. Bursitis is just not very fun to deal with. So this one is from Tamara, who says, 3 years ago, I broke my right leg in 3 places. That sounds fun. And it is still weak. I'm trying to build strength in that leg. I have some pain, but it is tolerable. My left leg is compensated for the right, and now having trouble right below with knee pain. Any ideas? Yes. So, as probably evidenced by what you heard me talking about earlier, I've broken a lot of bones as well. And this sounds like it was probably from an accident or a fall of some sort. It's pretty hard to break things that far apart, your femur, tibia, and kneecap, without something traumatic like skiing or motorcycle accident. So I broke my femur snowboarding. Didn't feel good either. I had a lot of similar issues. My legs started to waste away. I'm going to sound like a broken record here for a second. But high intensity exercise is probably the main thing that you can do. If you still find that that leg is extremely weak and you still find that that leg is actually smaller than the other leg, what I would do is go find someone to test it for you, to objectify the whole thing. Because a lot of people, their sensation of a side changes after they've had surgery or after they've had injuries on it. But I've known people who have had these injuries and felt weaker, and then we've gone and had it tested, only to find out it's not actually weaker. It's the same size, it's the same strength in all the standard testing. But what they don't have is great control. And so what they end up needing to do is essentially regain control of the entire area through essentially skill training. And that's the kind of thing I can't really know by reading an email whether or not that applies to you. But when it comes down to it, one of the things that actually helped bring my leg back, this was the other leg. So I broke my left femur, but I also had right knee surgery at one point. I did something called blood flow restriction therapy. If possible, I would actually search for someone in your town that does, it's called BFR for short, blood flow restriction therapy, because it's very good for post-surgical and post-injury rehab when you have atrophy and when muscles aren't coming back doing what they're supposed to do. So mine was probably about 18 months after a knee surgery. I couldn't get everything back. BFR was the thing that got it back, and some pretty high intensity exercise. And oddly enough, that's now my good leg, because I did a lot of work. So this is from Martha. I'm 71 years old and dealing with sciatic pain on my left side. It seems to hurt worse when I stand. I've started doing the stretch exercises as shown in the Better 5 class. They're helping out, but I just started. My question is, what kind of activities should I avoid? Is swimming good? How about walking? So for the most part, you're going to need to kind of find a reason for that sciatic pain. So the sciatic nerve is a nerve that essentially goes from your spine all the way down to your foot, and can change sensation in the entire area. So if it is worse while you're standing, then it's probably a very good idea that you take up something like swimming, and very good idea to probably do some things like yoga or Pilates, because they're actually going to help to stabilize the area and change how the area feels and functions, without you just standing in a straight line for a long time. And I'm the same. I've had 2 herniated discs in my back. I had severe sciatica on my right leg, and the discs were at different times. They were about 3 years apart. The first one gave me severe sciatica, and I had to change a lot of different things that I was doing. A lot of the time, if you're 71, sciatic pain can actually be from the discs in your spine not being injured, but just getting smaller. They start to shrink, they desiccate, they dry out. And so it can actually be from the bones starting to get a little closer to each other. So if you've got sciatica at 71, I would get that checked out just to make sure that you know it's not from a bone hitting on a nerve. Not that that's something insurmountable. It's just that you're going to change activities accordingly. But what I would do is I would test out activities, see how certain ones feel, see how other ones feel, and just act accordingly. For the most part, though, I'd want you to make sure you get it checked out. So this is a question about varicose veins. I have varicose veins in one leg and would like to know if it's safe to wear compression socks 24/7. Also, what do you think of compression knee sleeves? Do they help or do they lead to muscle weakness? So I can't comment on the varicose veins and the compression socks being worn 24/7. Again, I would find a physical therapist that's what they specialize in, and especially one who, as strange as it sounds, even though this might have nothing to do with you, deals with diabetes a lot, because diabetics tend to have swelling issues in the lower legs. And even though varicose veins are not the same thing as diabetes, they lead to the same type of problem. And I don't know whether or not wearing compression stockings 24/7 is a good idea. I would err on the side of no, but I don't know that one for sure. Whereas with knee sleeves, there's actually some research out there on knee sleeves showing that they do not lead to any kind of muscle weakness. So if you feel like wearing knee sleeves when you work out, which is just like it's a short sleeve that goes over just the part of your knee that's moving back and forth, I've worn them. I know lots of people that wear them. A lot of people don't want to wear them because they feel like they might become a crutch, just something you rely on. And for the most part, the research shows you can get just as strong, and it's not gonna get rid of the strength in your body to wear knee sleeves, which is pretty nice. right. So this is a pretty specific one, but I'm sure it will apply to a few people here. I've had 3 lumbar spinal fusions, and the lowest level is now pressing on a nerve and getting pain daily. I'm very weak, and it bothers me more than anything because I can't do much that involves walking. Now my right leg goes wonky, good word, and I sometimes stumble. So question is it possible that the weakness is permanent? That's how I feel, but maybe not. So, and they're talking as well about kind of their body weight and nutrition and things in here. So I will say this, that if it is on a nerve, it doesn't have to be permanent. It just, the pressure needs to be removed from the nerve. If you have bone pushing onto nerve, a lot of the time you can actually find a position of relief that'll actually allow it to come back. And I've seen this be almost instant in a few people where I've treated them not because I've done something, but I've walked them through a process of finding the position that can take the pressure off of a nerve. And what you're going to want to find is a therapist that specializes in something called neurodynamics. Neurodynamics is essentially the study of how nerves work based on physical inputs, whether that's stretch or shear or compression or whatever it might be. So I would find a physical therapist or chiropractor that specifically talks about neurodynamics. And if you're already working with a nutritionist, that's great. That's a wonderful step. Congrats on that. But I would say that finding someone that specializes in neurodynamics would be a very, very good idea because there is a chance that that can go away very quickly, but I don't know. I can't know that without seeing you personally. All right. Ooh, this is a long one. That one actually wasn't a question. Sorry for wasting 5 seconds of your time there. That was just someone saying how much they like the courses so far. So this is from Loretta. Hi, Loretta. She says, my problem is every time I start an exercise routine, be it beginner's Pilates or basic calisthenics or lightweight lifting, the right side of my neck and right hip becomes aggravated and painful. In the 3 years or so that has occurred, I've tried physical therapy, but the pain just gets worse. When I stop, things resolve, although I do still have slight discomfort. Thoughts? So the vast, vast majority of discomfort for the vast majority of people when you start an exercise routine is at the beginning, which really sucks, which is why it's hard for us to get into these routines. The interesting thing is our body adapts to it. Our joints adapt to it, but also our nervous system adapts to it. So if you were a client of mine, I'd be trying to figure out, is there a reason for that? Or is it just your body adapting to the problem? Because honestly, there's a lot of things that work themselves out. What I would say to you, Loretta, is I would give it 4 to 6 weeks. Be very gentle and ease into it, whatever it is that you're trying, and give yourself 4 to 6 weeks of consistent exercise and then judge whether or not it's still there. For most people, even if they're doing something like self-massage, like one of the courses we just got done recording actually, most people, I say, it takes 2 weeks for this self-massage to feel like a massage. After it's going to take some time to not just feel like you're just mashing a lacrosse ball into yourself. It takes a couple weeks. So I'd give yourself 4 to 6 weeks to see if you can figure out if it's going to naturally resolve on its own, because your body is adaptable. Up until the day you die, you can learn new skills, you can learn new languages, your body can operate differently. So I would give it 4 to 6 weeks. That's about the adaptation time frame for most people. We're actually through most of these now. So that is a nutrition question, which I'm going to skip for now. And you know what? I'm going to jump right back into the comments here for a second, just to see the last few that we've got. We're coming up on our time limit here. So this question is from Martha. What activities will aggravate sciatica pain? So for the most part, it's going to depend on the reason for your sciatica pain. If you have a disc injury, there's certain movements that will bother a sciatic pain significantly more than others. For most people, that's bending forward or stretching the sciatic nerve. If it is due to bone on bone, your discs are getting smaller and bones are starting to impinge on your nerve, the exact opposite is true. Bending forward and touching your toes will give you some kind of relief. So the reason I say that is kind of a cop-out answer. I apologize, but there's really no such thing as a set of activities that are invariably going to relieve sciatic pain. It's something you really have to figure out and kind of categorize for yourself, whether movements in specific directions or certain kind of movements really bother it for you. And when it comes to a true sciatic pain that is definitely due to a sciatic nerve or a nerve being hit, there's no reason to push through. And I'm just going to say that right now. If there's an exercise that hurts and gives you sciatic pain, it's not the kind of exercise that's just going to get better. Unlike one of the last questions I answered, which was about things adapting over time, a nerve is not going to adapt. If you're stretching it in a way it doesn't like to be stretched, you're pinching it or it's inflamed, doing more of that is not going to make it adapt. It is actually the kind of thing you want to primarily seek relief positions from. So just keep that in mind with sciatic pain. So this is a really common question from Dolores. She says, I'm 83 and I have arthritis everywhere. The less I do, the less I can do. Where do I start? And the easiest answer for that is anywhere. But the more specific answer is whatever you think you'll do consistently. So don't try to bite it all off at one piece. Don't try to take on every kind of exercise that you can right from the beginning. What you should be doing is finding something very small that's mildly challenging that you can still do without paying for it. And the reason I say that is I know people in their 90s that have tried. They exercise, they spend 20 minutes exercising the first day, and they feel good, and then the next morning they can barely get out of bed, and it all just goes to hell, and it doesn't work very well. So one thing I'd encourage most people to do is start with literally 5 minutes a day, see how you feel, and repeat that exact same 5 minutes every single day, and give yourself 10 days. And if after 10 days you go, I can do that, add 5 minutes, add another activity. It could be one of our Better 5 courses. It could be something you've made up on your own. But I just encourage you to start so small that you know that there's not a guarantee of success, but that it's not going to flare you up, and just create a routine out of it. So that is everyone. That's the same thing when you're 83 and you've got arthritis everywhere. It's the exact same thing that you would do if you were post-surgical. It's the exact same thing you would do if you just got in a life-altering car accident. It's just you start with the smallest thing that you can do well, and you slowly build over time. And just be patient. So most people, it's 4 to 6 weeks before they become fully adapted to something, and 12 weeks for certain things, depending on what it is. So for instance, in my own training, when I work out, I give myself a minimum of 6 weeks on everything. I don't let myself decide whether or not this is the right thing for me for 6 weeks. And that's just purely because I want to know how it feels once I'm adapted to it, not the first time I do it. All right, we're getting towards the end. We've only got a few more here. I know we're running past our time, but I think I'm fine to keep talking with you guys for just a couple more minutes. Oh, Janet tells me they have Voltaren in the US now too. Perfect. Voltaren is wonderful. So Sue is asking if my shoulder course is appropriate for someone who's had frozen shoulder with limited range of motion. The key word here is that they have had it. So actively, no. If you're currently experiencing frozen shoulder, no, it's not appropriate. And the reason I say that is frozen shoulder, there is almost nothing you can do that is going to speed it up. It's really unfortunate, but that's the reality. Is it's a very poorly understood diagnosis. But once you have frozen shoulder, you've got to let it ride itself out. And so if you're 2 years afterwards, yes, definitely jump into our courses. But frozen shoulder has a highly irritable phase where almost anything you do with it will really piss it off. So you really don't want to be jumping into doing this course if you happen to be in that phase. But if you've had frozen shoulder in the past and you just are really stiff, definitely great course for that. Hello from France. Oh, that's nice. I love France. I've been there many times. Do you have any help for neuropathy? I had failed back surgery 13 years ago. Left me permanently disabled with nerve damage and spasticity. Neuropathy in legs and feet has gotten worse in the last year. So again, I'm going to refer to primarily this should be dealt with by a physical therapist that deals primarily with neurological injury. It's a specialty. And the reason I'm referring to them is because I could come up with some things that may or may not help you, but they're going to be specific to you. And it's unfortunately very common after low back surgery. It's called failed low back surgery syndrome. It's so common. They actually have a syndrome for it, that people get low back surgery and they're left with nerve injuries. And it's common. It can be made to improve, but you're going to want to seek someone that's what they deal with. And you may also want to find, again, a chiropractor that deals with neurodynamics, which is a word that I used earlier. Neurodynamics is really, it's if they know what that is, or if it's on their website, there's a really good chance they'll be able to help you. So I've got only 4 more questions here. So the Dolores Thanks for paying attention, Dolores. Correction to my question, where do I start? I'm going to assume based on this correction that you mean physically through your entire body. I would physically start with your core. One of the main reasons is your core is essentially what gives you the ability to do almost everything else that you could want to do. If you have an extremely weak core or you have a lot of pain, it's going to be very difficult for you to exercise your legs, your arms, your shoulders, your neck, almost anything. I would start with your core and start your midsection. So start in the middle of your body and work your way out. So I would start with some core and some low back, and then move on to hips and then shoulders, and then you can move out from there. For most people, that's going to be the easiest, or not the easiest place to start, because it's not easy. None of this is going to be easy, but it's going to be the place that you can start that is going to set you up for better long-term success when it comes to exercising in other areas of your body and for a longer time later. My husband would like to know the best exercises for sacroiliac pain. So sacroiliac pain is very tricky. The reason being there's a lot of debate in the medical community about what really constitutes sacroiliac pain, because it's very hard for us to get rid of sacroiliac pain because the joint itself doesn't move very much. But for most people, the thing that you can do that's going to help sacroiliac pain the most is actually training your hips and training your legs in a big range of motion. So what the SI joints, sacroiliac is the long version of SI for SI joints, which is in your low back, the back part of your pelvis. What they do is they tilt. So your pelvis tilts and rotates one way and tilts and rotates the other way. So most exercises that are going to encourage that to happen, that are going to make the joint move a little better, are going to be single leg. Things like lunging and step ups and going for a walk by taking a big stride length. Those are the things that are going to help, where one leg moving to the other, side to side, front to back. So try to make a lot of your exercises one leg at a time. That tends to be the big thing we can do to start helping sciatic pain. I think we've got 2 more. All right. So I'm going to do these last 2 here. Mostly because they're going to be a little easier to answer in this context. So pain inside the shoulder blade, one of the most common pains that people have, and base of neck, the shoulder from working on my computer. I was going to say you must be a computer worker or a dental hygienist because they get them a lot as well. My arms and left keyboard, eyes level to screen top. Any suggestions to relieve? So for most people, pain between the shoulder blades, one of the biggest things that you can do is actually strengthen the area. So an upper back strengthening routine is really going to help, but also foam rolling and self-massage. If you have a job that requires this and it's going to bother you and you know it's going to continue to bother you, I would, 1, strengthen the area. I would 2, get a foam roll and a lacrosse ball, and either from our courses or from something else, figure out how to work on the area yourself. And then number 3, I would get a posture shirt. So the one that I've actually really enjoyed myself is from a company called IntelliSkin, which is short for Intelligent Skin. IntelliSkin, they're really expensive. I'm not going to lie. It's not the kind of thing that I take lightly recommending, because I know it costs some good money. But I have one of the shirts and I wear them if I'm going to be on a plane, traveling to the other side of the world. For some reason, I'm going to be sitting for that long. I wear it if I've got a marathon of writing or reading coming up. And a lot of it's just because it naturally takes a lot of the stress off the muscles in your upper back. So get an IntelliSkin shirt, strengthen your upper back as much as you can. It's really easy to find some exercises for that. And then foam roll on the cross ball. That's probably the best combo that you can get. So talking about Voltaren, I'm just going to expand on Voltaren. So one of the reasons that Voltaren actually works is because it delivers a ton of anti-inflammatory to an area that you cannot get as much by taking pills. So if you were to take, when you take something like an Advil, Tylenol, the vast majority of these things don't go where they're needed. So say your hip hurts and you take a Tylenol and it feels a little bit better. You've got to know that really only 2 to 3%, maybe 5% of what you're taking is actually going to that area. 95% is circulating around your system. It's going everywhere, which may or may not be a problem. For a lot of people, it's not. But personally, I just don't want, if I have something that requires an anti-inflammatory, I usually don't want to take so much of it to get to the level that it's going to do something, especially with a bursitis. So I would use Voltaren. So in my household, personally, I actually don't have any Advil or any Tylenol, which is really saying something considering all the injuries I've had. But I have a tube of Voltaren in like every second room because it allows you to get about 90% of the anti-inflammatory on the area that needs it and into the area that needs it, and only about 10% gets absorbed and circulates through the body. And so that's one of the reasons that I actually recommend Voltaren a lot. It doesn't have to be Voltaren, but it could be something like that, as long as it's actually medicated. And Voltaren, for anyone listening, if you put it on, it's not going to feel like it's doing much because it doesn't heat, it doesn't cool, it's medicine. And that's actually pretty important for a lot of people. I'm sorry, Mary, about skipping your question about a meniscus. I'm not entirely sure how I missed that one. We ended up with a lot of emails and a lot of comments here. So a torn meniscus is something that does not have to hurt. That is actually the surgery I had. I had a torn meniscus in my right knee, and it's a lot of the time they don't recommend surgery on it. For mine, my knee was locking, so it had to be done. I couldn't straighten my leg beyond about 90 degrees. It was really bad. But for the most part, in my practice, the vast majority of people, exercise does help a torn meniscus. All you're going to want to do is make sure that you're very slow and you're very controlled and you're very intentional with your exercises. But yes, exercise, it won't necessarily heal a torn meniscus, but it will help you control the way that your knee moves, not because it's going to be injured, but it's going to help you control how your knee moves. And just exercise has a global effect that will end up helping your meniscus. So a lot of people have torn menisci is the plural, that it doesn't hurt. And a lot of the time, if you have a torn meniscus that is causing pain, sometimes it can be surgical, but a lot of the time you can exercise out of it. So yeah, exercise for a torn meniscus is a very good idea. So we have had a couple hundred questions at this point, so we are going to have to skip out here on a few of them. But we'll do this again. You guys really jumped in here. We had over 100 people in the room at one point, which is absolutely amazing. So we've got a lot of other courses coming up, and I just want to tell you guys about them. So I've been filming a couple times a week in here at the studio. We're doing a lot of self-massage courses, which is something that I have done a lot of in my life, using foam rolls, lacrosse balls, rolling pins, those sorts of things. We're doing a lot of self-massage courses. I was the most excited and advocated to make those courses because you can make yourself feel better really easily with these. We've started doing wrist and elbow courses. We've got some stability ball courses as well. And we're just going to keep them coming. We're going to try to be getting a lot of new courses out there. And what I'd encourage you guys to do is interact anytime you have the opportunity. So send an email to Better5. You can comment on stuff on social media. I'd encourage you guys to show up to these sorts of things as well. So we've got some full body strength that we're in the midst of finishing right now. We're doing some stability ball programs, some that require you to get on the floor and others that don't. And then doing some wrist and grip strength. That's a really important one for me. I've had a lot of injuries out here. And a lot of others. There's a lot of different things coming. So thank you for coming, everyone. I apologize. There's going to be a few people that I didn't end up getting to their questions, but if you like this, feel free to send an email to Better5. Feel free to comment saying, hey, I'd love to do this whole thing again. I'd like to do this, guys, with you. I've done this before, and I absolutely love it. It's really nice to know and to actually be interacting with the people rather than just filming and sending it into the abyss. It's nice to know you guys are getting a lot out of this. So thanks for coming, and I will see you guys next time. Ended.